My name is Richard Vaughn. I'm a nurse and I work in the cardiovascular intensive care unit on the 4th floor here at Adventist Health and Rideout. So one of the things I find so rewarding about my job is it feels as if, because I get to work in this community, that I have my finger on the pulse of what's going on in healthcare. I know that we've had many struggles. It started out really rocky. We were prepared for COVID months before it hit us. I know the emergency department had tents set up for months, and the community looked, and my general their thoughts about what happened was, oh, we have tents set up, but we're not going to need them. And then as the months passed, COVID hit, and then everyone started to finally see what we've been seeing this whole time. So I don't have any particular patient story to speak of, but what I can tell you is there is a theme in the critical care units, both in ICU and in the cardiovascular intensive care unit that I work in. And that theme is a lack of hope. People are having the worst day in their life over and over and over. And we have so many jobs as a nurse. It's not simply knowing what medication to give or knowing the pathophysiology of what needs to happen next or what to anticipate, but as being an advocate for those patients, we have to be there by their side when they don't have hope, when they don't know what to say or what to think next. We have to help them through those hard moments to get them through it. Part of our mission statement is creating change in the community. And by being a part of this community, one thing that I've really come to know is that there's a lot of speculation on COVID-19 and whether it's real or not. And I can tell you what I do know. It is real. People are dying, people are suffering. I know people personally that they didn't think it could affect them, and they've just been recently affected, and they now know more than anyone that this is real and it's hurting people. And the effects can be long-lasting, and we don't know everything about the virus, but what our community needs to know is this is real. It doesn't matter how it got here. It doesn't matter to what extent the long-lasting effects are going to be, but it's our job now to do whatever precautions we can, whether that's wearing a mask, staying 6 feet apart. I know everyone wants to open up schools in this community, and I do too, but we got to do it safely. So let's just move forward with the best information we have right now. One of my greatest strengths as a nurse is empathy. The one concept I fully understand in all situations is I don't know everything. And there's nothing more true than you don't know what a person is thinking and you don't know what a person is feeling. It's always true in every situation that I have never been going through exactly what my patient's going through. And so I always do whatever I can to put myself in that situation enough and to empathize with them, because I can't imagine what it's like to not be able to get out of bed, or essentially be told you can't get out of bed and you think you can. We're not really willing to roll the dice on things like that, and it's got to be tough. So empathy is key to our profession.